Good morning, students. With this presentation, we will know about the changes and abnormalities in vital signs. Vital signs are indicators of body's functions. They are useful in evaluating and monitoring body's various parameters. Routinely measured vital signs are body temperature, pulse, respiration, blood pressure, and saturation. Coming to the introduction, vital signs plays a key role in providing patient information and helps to decide in an emergency. Vital signs are influenced by many internal and external factors. Abnormal vital signs are the indicator of a disease or disorder or due to consumed medicines. Abnormal body temperature may indicate a balance between heat production and heat loss. A healthy body maintains its temperature within the optimum range of 36.5 to 37.5 degrees Celsius using homeostatic thermoregulation. Any imbalance in this process due to known and unknown etiologies leads to abnormal body temperature. Hypothermia might be due to infections. The sources are respiratory, cardiovascular, gastrointestinal, genitourinary, neurologic, soft tissue, and systemic. Non-infectious are endocrine due to thyroid storm, pheochromocytoma, and drugs such as tricyclic antidepressants, sympathomimetics, anticholinergics, amphetamines, and serotonin syndrome. Oncologic like leukemia and lymphoma. Non-infectious continues as due to neurologic subarachnoid hemorrhage, autoimmune disorders like rheumatoid arthritis, systemic lupus erythematosus, immunodeficiency syndrome. Others include myocardial infarction, pulmonary embolism, subarachnoid hemorrhage, high environmental temperature, and exercise. Hypothermia may be due to increased heat loss related to low environmental temperature, burns, dermatologic conditions like severe psoriasis, ethanol, which causes vasodilation, and may be due to impaired thermoregulation, central related to subarachnoid hemorrhage, and in peripheral spinal cord injury, peripheral neuropathy. And can be due to medications like beta blockers, alpha adrenergic agonists like clonidine, meperidine, and neuroleptics. Other causes like aggressive fluid resuscitation if it is unwarmed. Next, we will move on to abnormal heart rate. Abnormal heart rate and rhythm are called as arrhythmias. Arrhythmias are due to problems in the structure and functions of the heart. The types of arrhythmias are tachycardia and bradycardia. Tachycardia is a fast heart rhythm with a rate of more than 100 beats per minute. Bradycardia is a slow heart rhythm with a rate below 60 beats per minute. Tachycardia can be sinus tachycardia due to decreased oxygen delivery in case of shock, hypoxemia, and anemia. Can be due to increased oxygen demand in case of infections, hypothyroidism, exercises. Others causes like stress, pain, drug ingestion, withdrawal, and hypoglycemia. Tachycardia can also be due to dysrhythmias related to supraventricular atrial fibrillation, atrial flutter, multifocal atrial tachycardia. Ventricular causes like ventricular fibrillation, torsidus depointus, polymorphic ventricular tachycardia, and ventricular tachycardia. Bradycardia may be due to asymptomatic, well-trained athletes, a symptomatic in case of syncope, dizziness, chest pain, fatigue, shortness of breath, or structural and electrophysiologic, sixth sinus syndrome, sinus node dysfunction or sinus node disease, AV block, myocardial ischemia, and other causes like metabolic hypothyroidism and electrolyte imbalance such as hypokalemia and hypercalcemia. Bradycardia can also be due to drugs like beta blockers, calcium channel blockers, and digoxin. Others due to elevated intracranial pressure, hypothermia, toxic ingestion like lead poisoning, gamma hydroxybutyrate, opioid overdose. Now we will see about abnormal blood pressure. Abnormal blood pressure is a measurement of increased or decreased force exerted by the moving blood through the arteries of the body. High blood pressure, hypertension means systolic blood pressure ranges from 122 to 129 mm of Hg and diastolic blood pressure of less than 80 mm of Hg. Low blood pressure, hypotension means systolic blood pressure of less than 90 mm of Hg. Hypertension can be due to primarily idiopathic and secondary due to endocrine related to pheochromocytoma syndrome, thyroid disease, pulmonary related to obstructive sleep apnea, and vascular cause sclerosis and aortic coarctation. Causes like thyroid like pain. Hypotension can be due to inefficient heart rate, tachycardia, where decreased diastolic filling time, and in bradycardia, decreased cardiac output. Decreased stroke volume, decreased volume related to dehydration and hemorrhage, obstructive flow related to cardiac tamponade, pulmonary hypertension, pulmonary edema, tension pneumothorax, and poor cardiac performance like decompensated heart failure, acute myocardial infarction, acute mitral aortic regurgitation. Hypotension can also be due to decreased systemic vascular resistance like sepsis, anaphylaxis, vasodilatory medication overdose, ACE inhibitors, calcium channel blockers, and nitrates. Abnormal oxygen saturation is the decreased stage of oxyhemoglobin, oxygen-bound hemoglobin in the blood. A value lower than 90% is considered as low oxygen saturation. Hypoxia, low inspired oxygen, can be due to environmental monoxide poisoning or altitude. Hypoventilation related to due to sedation, stroke related to myasthenia gravis, and amyotrophic lateral sclerosis. Hypoxia can also be due to PQ mismatch related to atelectasis, COPD, air plugging, lobar collapse, diffusion abnormality related to emphysema, pulmonary fibrosis, pulmonary edema, right to left shunt in case of pulmonary Abnormal respirations. Abnormal respirations are multiple and includes apnea, orthopnea, dyspnea, hyperpnea, hyperventilation, hypoventilation, tachypnea, Kussmaul respiration, Cheyne-Stokes respiration, sighing respiration, Biot respiration, apneustic breathing, central neurogenic hyperventilation, central neurogenic hypoventilation. Abnormal respiratory patterns reflects the underlying injury or metabolic derangements of internal organs. Tachypnea can be due to pulmonary causes like asthma, COPD, pneumonia, pneumothorax. Cardiac causes like pericardial effusion, pulmonary embolism, cardiac ischemia, congestive heart failure. And hematologic causes like anemia. Metabolic acidosis related to ketoacidosis in case of diabetic, alcoholic, and starvation. Lactic acidosis, uremia, renal failure, toxic ingestion. And other causes like voluntary control, carbon monoxide poisoning, exercises, anxiety, and stress response. Bradypnea can be due to drugs like opiates and sedative hypnotics like benzodiazepines, alcohol, and cholinergics. Neuromuscular disease like myasthenia gravis and ALS. Other causes like increased ICP, hypothyroidism, and uremia. This chart will give you basic vital signs from neonates until adolescence. In neonates, when they are awake, their heart rate would be around 100 to 205 and they are asleep 90 to 160. And as age increases, their heart rate reduces from 80 to 120, reaching up to 90. Respiratory rate in an infant will range normally from 30 to 53, and as they grow, it tends to reduce in counts and reaches in adolescent a range of 12 to 20. Blood pressure during birth, the systolic will range from 39 to 59 and diastolic 16 to 36. As they grow, they reach the adolescent range of systolic blood pressure of 110 to 131 and diastolic blood pressure of 64 to 83. And temperature, the range from 36.5 to 37.5 in the axillary. And with related to oxygen saturation, SpO2 is lower in the immediate newborn period. Beyond this period, SpO2 of less than 90 to 92% may suggest a respiratory condition or cyanotic heart disease. To conclude, children have a very range in their vital signs, ranging from a low to high body temperature, blood pressure, saturation, respiration, and heart rate. It's very vital to know the basic vital sign measurements from newborn until adolescence and to understand the cause for various change in parameters to assess them during an emergency or a regular care. Thank you.